around that in terms of, you know, how your employees actually feel about it too. Your tolerance for risk is very critical here. And part of that comes into the technical solutions that you may want to, the road you may want to go down for technical solutions there. So the real question is, how can a practice allow employees to use mobile devices securely, including devices of their own choosing, to access business information like your email or patient information electronically? So you have to examine not where you are today in terms of a mobile device use. They're ubiquitous, they're everywhere right now, but what you think you'll need in the future. So really stepping back to look at policy is the first thing you want to do. So with no explicit policy to restrict use of mobile devices or media, you may have already given tacit approval to use them. But the desire of both employees and patients to use them is overwhelming IT departments, and especially what we're seeing is impacting small providers who don't have an IT department to consult with. So not taking a formal position with or without that expertise really says that vacuum may have already been telegraphed to your employees. Go ahead and use them. So your big solution has to do with your people in many respects. The most pragmatic step you can take is to define your policy around mobile devices and mobile media. And when we say mobile media, what we're talking about is CDs or DVDs or flash drives. Okay, these are other devices that will wreak havoc, to tell you the truth, so as much as mobile devices. So training them, any staff impacted, is also critical. But your policy should state your general position on the use of mobile technologies and any restrictions that you intend to put in place. So it takes quite a while to evolve that policy when you start pulling it apart. Then your procedures that you'll need to define will define how you're going to implement that policy. Exactly how it will be controlled and how mobile devices will be controlled in the organization and monitored for effectiveness. And these are two steps I think people often leave out. They may scramble together and put a policy together, but monitoring that policy, understanding that it's being effective, is often a procedure that gets left out. In many instances, your policy can be expressed very specifically when you intend to introduce software or hardware that'll help you manage those devices and media more closely. So an example of that would be if all your mobile device IDs, and that's whether they're corporate or individually owned, have to be pre-approved and pre-approved and preloaded by your network administrator prior to allowing that device to acquire access to your internal network. You know, even if the user can supply a valid logon and password. This way, an employee can't simply trade in an old phone or laptop and still be able to access your network with a new device. Now, if the manpower demands to control access that tightly is just beyond your capability, your policy may simply say that you'll monitor all mobile device access to your network. In other words, you're consciously accepting the risk of various unidentified mobile devices gaining access to your network using a logon and password. So someone in the organization should have the responsibility to look at a log of access attempts at a minimum, okay, by non-tethered devices. You're used to your desktops being attached to your network, attached to your systems and your network. So at least periodically, someone needs to look at who is accessing and with what types of devices. So you need to do that in order to say you have some controls over access to your network by users. So generally speaking, whether it's a mobile device or a tethered device, there should be a policy to do that. But sometimes your mobile a procedure to do that when your policy cannot be any tighter than you must have a log-on and password to access our network from your phone, or from your mobile device. At least put some monitoring in place. So while training everyone impacted by the introduction of a mobile device policy is a must, if you're simply requesting that your employees adhere to your policy and you have very few technical solutions to assure it gets implemented that way, it'll be critical to get buy-in from your employees before you open the gate. So your procedures, as you look at this list on the screen, will say media holding PHI must be physically secured at all times. And how are you going to do that? All of that, maybe you're tight enough to say all devices must be approved. A lost device must be reported immediately. Just get that job, get that understanding in there and to whom they report. And then anything on the device should be encrypted. But mobile device also shouldn't be willy-nilly disposed of without somebody looking at it and assuring that there's no PHI on there. So you would want some procedures to do that. So these are those things that you would think through of what happens with a mobile device that we need to accommodate. So, and any staff that's affected, anyone that's allowed to use mobile devices to access PHI in particular, and also your business information, even your email. They need to be educated on the controls in place to secure that on any kind of mobile devices. The vast majority of breaches of PHI are due to lax policies and inadvertent mistakes by internal staff, our trusted business associates. We're seeing that over and over. I think what hits the news is all the major breaches by the Targets and the Home Depots of the world and some major hospital systems, sadly. But the vast majority, happen onesie-twosies with an individual and a business associate relationship with a covered entity or the people within the covered entity. So another real pragmatic step then is to take regarding these devices is to train your staff on the proper use of these technologies. So make them intimately aware of the risks that expose the practice when they're not used properly. So the security practices that you expect, and some of them are as simple as requiring passwords on their device, immediate notification of the loss of the device, locking up laptops when they're not in use. There's many ways to begin to secure these mobile technologies. But the real important thing is to stress their use and protection when they're not on site. That's when you have the most protection of these devices. Because when they're not on site is when the employee bears the most responsibility and when the vast majority of mishaps happen. So this policy actually gets linked to your other policies, your acceptable use policy perhaps, your PHI protection policy. So they're going to be married together eventually and should support one another. And it's really easy to forget about mobile media, okay? Patients bring in their own medical information on CDs, DVDs, flash drives, and are they ever encrypted? I would estimate that would be never. And there are many ways to control the media once it arrives. Okay, you probably have logs. Okay, so-and-so brought it to me. Or you're scanning the document into your medical record, and maybe you're handing that back to the patient. But if you are generating PHI on mobile media, do you have something simple in place, like a form that the patient signs acknowledging I'm handing you electronic medical, your personal health information, and it's unencrypted? Maybe you don't have the wherewithal to buy encrypted jump drives to hand to people. They're 5 times more than the ones that you get given to you every time you go to a conference. So that may be critical to you to say, I don't want to worry about it. I want to know I'm not handing somebody something that's not encrypted. But if you can't do that, acknowledge to your patient that I'm giving you unencrypted data, and my expectation is you're going to protect it just like we would if we were wandering around with it, okay? So I think it helps educate everyone that they realize this is an important thing to you. And I think it's just an easy step, very pragmatic solution to make your patients aware. I'm wandering around with my information unencrypted as well. So if you look at like technical safeguards that are available, what solutions can be leveraged, okay? There are a lot of options here, and there's just a very short list on here with encryption. There's some cloud storage solutions that could help you in terms of data at rest. That could be secure firewalls, secure APIs that can be used. And I think many people are now realizing that their electronic medical record system can now be viewed, be accessed on mobile devices. So they're beginning to write better APIs that do encrypt as the data is transferred back and forth. And of course, your firewall configurations can be very tight. The compliance with the security rule depends on some of those factors we already talked about, right? The size, complexity, and capabilities of your company, your technical infrastructure, what hardware and software security capabilities you really have. Do you have to introduce a whole lot of other technologies to protect that new technology? Actually looking at the cost of those measures. And then weighing the probability and criticality of risks for this PHI getting out. So if you are purchasing laptops, and those are the only laptops that are used to access your system, and you require those laptops to be left in-house and nobody's traveling off with them, and you have some tight security controls, even if they're not encrypted, you know, sometimes you're okay. It just depends on how tightly you can control that type of device. But they do present the greatest potential risk to PHI when they're not managed. You just read about it all day long there, but there are innumerable technical solutions to solve PHI in transit, PHI resident on mobile devices, and that includes text messages and email. You probably have procedures that you ask your physicians. If you're talking on the phone and getting a consultation from another physician, you make note of that in that medical record chart, that that decision was collaborative potentially. Well, that's what happens on a text message. If they've texted somebody and said, hey, is that lab, coming back indicating cancer, and they're making clinical decisions based on that text message, don't you want that in the medical record? So there are exposures when you're not doing that, and your policy can say, just like a phone call, you must treat text messages the same way, or email messages the same way. So, those again go back to policy. Policy can be very rich or can be too brief. But unless you research like the cost and benefit of some technical solutions that are out there and really test their ease of use and how effective they are in your situation, it'll be difficult to formulate a really good policy, a really comprehensive policy. The gold standard for any of these is to ensure that PHI is suitably encrypted in transit or at rest, of course. And speaking of encryption, I think this is the big bugaboo that everyone is dealing with right now. And it's a much maligned piece of software, I would say. It's vastly improved. I think some people feel like, oh, it just deteriorates our performance too much. We can't encrypt all that stuff. And I think bandwidth has improved. So much has improved that probably in testing some of these applications, your staff might be hard pressed to say, oh yeah, I know that got it. I know that got it encrypted because it took 0.00014 seconds more to do. So I think that we're overcoming that right now. Is people are realizing it's not deteriorating performance to the point where if you did have a breach, and you read often that people say plan on a breach. I mean, you're going to have one of these devices. but it's not really a breach if you've got passwords required, if you've got encryption enacted, or you have to use an application that requires encryption to communicate. That's really the way you avert a breach when one of these devices gets lost or you can't put your hands back on it. And it's the best practice in any industry. We kind of talked a minute ago about banking, but there's many industries that, feel strongly about the use of encryption for security purposes. There are so many options that it would be impossible for us to say to you, oh, everyone should use this product. You just can't do it. There's too many questions to ask in terms of your technologies that you're using and what your network looks like. And again, what can your IT people support? Go down that road for sure, because if you're asking them to do something you have no idea how to deal with, it'll be much more difficult to get the job accomplished. Sometimes, they're just technologies you need to research for a while. I don't think it's anything you can just jump into every time you get an ad from somebody that's going to solve that problem. Anyway, my last thought there is just do it. I think everyone needs to look at encryption. Where does it make sense? And on what devices do you require it? Or what technology do you have to use? I'm sorry, I don't have the answer. There's probably not one answer. Adam, I think you're going to pick up on enterprise use agreements for a few minutes.
I am. We do have a question, Susan. I'm not sure if you've seen it, but it sort of follows on what you were just saying.
Right.
But the question is there a text secured software application that is recommended, or maybe not necessarily recommended, but I'll say maybe one that you have used in the past?
And we do have some clients that are testing and using some applications. I guess I'll drop a name. I know of one contract using Zix. There are others that are out there. I have not tested them myself. It's because of their architecture that they decided to go that route and the number of mobile devices they're using. They're using tablets now for their patients to sign in and make payments and all kinds of things. So one thing I didn't hit on too much was your patients, okay, and their desire to have greater access to you through mobile devices. The day is coming sooner than later, then they're going to want to say, oh, just email that medical record to me, okay? So how do you do that? How do you do that securely? And a lot of people are putting portals out there to avert that, okay? That can solve your problem. Say, do download it, if you want to get it from there. But there is text messaging software that will actually load that text message back to the computer. If you've got one of your administrative people then distributing that to the proper medical records. There are some nice products out there, I must say, but that is one that I do know one of our clients has recently implemented because they've taken on so many mobile devices.
Okay, great.
This is Lavanya.
Yes.
This is Lavanya here. I have a question. Like, are you using any particular encryption? For the mobile devices?
Are we using encryption? Okay, I'm not in a healthcare facility or part of an organization that is creating or using electronic medical records. We are just advising and actually helping put in policies and procedures for our clients. So I am not using specific software myself. Just passwords on my phone, just good business practices for not wanting people to get access to my computer. Just personally, as you look at those things personally, what do you want to protect? The information you have on your own personal things. we didn't have time. We are trying, I hate to say it, keep um, our webinars to 30 minutes. We realize everybody has a limited amount of time. So we didn't talk a lot about what you do in your own device and what your policies are when you allow people to use their own device. That they understand you may have to wipe their device if they lose it. And, you don't want them, even though it's theirs, to trade in a device potentially. You could get very tight on your policy to say, I need to see it before you trade it in, even if you're not restricting their use on the network. So that's one of the more difficult things to do, is they have personal information on those devices, and what is your position on that if something happened to that device. But I don't myself, I guess, have a need for encryption. I can turn it on my laptop. I'm not transferring records, in any way there. So I'm not sure.
Okay, do you know what kind of firewall configurations are you using? You mentioned about.
It does depend on your firewall again. So everyone is different, but you do have the ability to identify every device usually, and it takes administration to do that. And I'm not, whatever way your contract is reading with your vendor, maybe if you don't have in-house IT people, they can help you with that. And you may have to put additional software on, or appliances, they call them often. But that's taking it to the point where you really want to restrict access to your network. It is a lot of management because there's so many mobile devices out there. You really should be doing an inventory anyway of what mobile devices are being used, but a lot of people aren't keeping good track of that.
Oh, okay. This is more logistics question. Would you be able to send this presentation?
Yeah, I want to just sort of, I have one more slide I just wanted to touch on, and then I want to wrap up our prepared remarks. But I think Susan and I can stay around beyond the bottom of the hour for anybody who has any additional questions, but at least we'll have gone through all of the information that we wanted to cover for those that need to move on to the rest of their day. But I did.
Adam, you might mention it is being recorded, and you will be putting it out. I think
correct.
She did.
Yes. Yeah. Everybody will receive a copy of the slides as well as a recording of the presentation. If not late today, early tomorrow. So.
Thank you.
Of course. But before we do wrap up, I did want to talk just briefly about enterprise use agreements. I think it dovetails nicely to some of the points that Susan made earlier about the people part of the solution. And an enterprise use agreement is something that is signed by each staff member, sort of in addition to maybe a confidentiality agreement. And it really codifies the organization's policies and procedures relating to, in this instance, mobile devices, and really requires each staff member to acknowledge in writing that they understand what they're permitted and not permitted to do. And it also outlines clearly what violations are, and punishments will be well defined and consistently enforced, which is important. The legality of them, they're certainly legal, whether they don't shift the liability necessarily to the staff member who may do something in violation of an enterprise use agreement. But it really is, going back to our original theme, a pragmatic way for organizations to really emphasize the mobile device policies and procedures that they have in place. So, and just quickly by way of conclusion, I mean, we've really tried to make this very pragmatic again, and mobile devices solutions come down to people, clearly identify policies and procedures, training, and in some instances, enterprise use agreements, and finding out what technology really is best for your specific situation and organization. So, and just to sort of wrap it up here, as I mentioned, this is being recorded and everyone will receive a copy of the slide deck. I will also include Susan and I's contact information in there, and you can contact us down the road if you have any clarifying questions or any additional information we can provide. We try to do webinars every 2 to 3 weeks, and our next one is going to be on incident response and breach notification, and it will be on October the 8th, which is also a Wednesday at 1 Eastern, and I'll include a registration link for that as well in the email that will follow. So I will open the floor up again for anybody that has any additional questions. I actually have received one, Susan, I think something you touched on earlier in relating to business associates. And it really goes to, can mobile device policies and procedures be extended or maybe enforced on business associates? Is that something that's appropriate to put in a business associate agreement, for instance?
I would recommend that you agree to that with your business associates especially when they're working, for instance, in your office with, you have someone do an analysis on your claims and they take off with that. I know some of our clients say only the network administrator or the IT security manager officer will download that information to them and assure that it is encrypted on the laptops and look at how the laptops are being used, or put it on an encrypted flash drive. So you know who's getting data, exactly what data they're getting, and how you're going to control that. I think you have the ability to put those policies in place with anybody doing work for you, and you can be that specific in your business associate agreement. They are signing agreements that say, we understand our culpability in protecting PHI. So, technically it's already there, but you may want to highlight it for any kind of work that when they're taking off with a lot of your information and leaving your premise. That's the exposure that you have.
I agree, and I mean, from a legal standpoint, business associate agreements are either the covered entity saying what must you do, or the business associate promising what they will do, and in relation, mostly to safeguarding PHI. And while there are lots of examples out there, business associate agreements, some of which have been put out by the federal government, there's no reason why, if this is something that is of particular concern to an organization, whether they are a business associate or a covered entity, that they can get to that granular level and say, specific firewall configurations or specific notions necessary within a mobile device policy for a specific organization. So there's no preclusion on getting down to that depth within a business associate agreement, and it's probably not a bad practice to have if one has the wherewithal organizationally to take that on and then follow up on that. So
yeah, worst case scenario is you have procedures in your organization that keep them from doing anything crazy.
Correct.
You don't have to worry about them so much.
Certainly. Any other questions for folks on the line, or anyone else have a question that they would like to type in? And while I sort of give people time to formulate any final questions they have, I do want to encourage folks who who may not be participating to sort of, check out what is going on across the country with Health IT Week. It grows a little bit every year. And as I mentioned earlier, there are some good things happening this week. There's great dialogue. It's about not just what the future holds and what's good about what we're doing, but also, sort of what this webinar is and how do we ensure that we best utilize the technology that we have.
I see another thing coming up. My compliance officer didn't read anything specific related to texting, and I presume they mean in HIPAA and securing text messages. But text messages are just as open as email messages on those mobile devices. So I think that is one of the first places that we are seeing exposure for our clients. And I'll lay it back on the physicians wanting to get information immediately. There's been a lot written about pagers not being secure, and things like that. So I guess it's looking at your devices and see what you have, what kind of applications you have on there. But I don't think the rules are not going to mention specific technologies, because they change daily. And so the rule itself is much more general, I would say. And you're not going to see them mention specific things like that.
Yeah, and notoriously HIPAA, or HIPAA is notoriously vague, for better or worse.
Right.
So.
Well, and so is NIST. When you look at the guidelines that NIST put, that's what HIPAA is based on, the National Institute of Standards and Technology recommendations and guidelines. And they have to be that way too, because they can't keep up with the change in look now, you now have wearable devices that your patients are going to want you to import that data to their medical record. And you're going to want it someday, I hope. But, that's already happening. We have e-visits happening. We have all kinds of new things that are coming into healthcare. So they can't name, specific technology. They don't require you to do biometrics to get your laptop open. And that's because people choose to go that tight or they don't.
Right.
There's many options.
This is Lavanya here. I know I heard of NIST as a security level that HIPAA compliant to, but is there something else that the software provides beyond HIPAA and NIST?
I'm sorry, I didn't understand. Did you hear?
Can you repeat your question? No, can you please repeat your question?
Well, I was just wanting to know, is there any other protocol beyond HIPAA and NIST, security protocol that a firm needs to comply with?
Well, if you take credit cards, you're subject to PCI requirements. And those are very, very similar. If you do a mapping from HIPAA and NIST to PCI, you're going to see quite a bit of overlap there. And as you noticed in the news, point of sale devices are a real heartache right now in terms of that's how breaches have, many of the huge breaches have been accomplished through those point of sale devices. I listened to a webinar recently where someone who's an advisor for that said the bank will know long before you that you have a breach of your credit card systems. So yeah, it goes beyond HIPAA and high tech, unfortunately, with other technologies that you're using in your office.
And also, many states have specific requirements. A lot of which are on the privacy side. There are also, speaking of privacy, there are also different privacy requirements when it comes to different types of health information. For instance, behavioral health information, substance abuse, and whatnot. The the regulatory environment in which health information in general is a complex one, and unfortunately extends beyond just HIPAA. Okay. Well, I think we have we've addressed all of the questions that we have in the queue. I really appreciate the people, everyone who's stayed on a little bit over our time. I really hope the information has been useful. As I said, Susan and I will, you'll have our contact information, and feel free to let us know if you have any additional questions. Continue to engage Health IT through the week and going forward. And, we hope to see you on the 8th for our next webinar. And please, if not later today, early tomorrow, look for an email from me following up with the slide deck, contact information, and anything else. So thank you very much, Susan. Your insight is always highly valued. And thanks to everyone who participated.
Have a good day.
You too. Thanks.